Today we're looking at muscle tone assessment, and muscle tone is defined as a continuous state of mild contraction or a state of preparedness in the muscle. And everyone exhibits muscle tone, but you would want to assess muscle tone in someone when you think that they may have abnormal tone. And abnormal tone can be caused by the damage to the nervous system, most often in the central nervous system, through things such as stroke, traumatic brain injury, spinal cord injury, or diseases such as MS. But it can also occur within the peripheral nervous system, such as through a nerve compression or brachial plexus injury. So when you are rating muscle tone, it can either be mild, moderate, or severe. And mild presents as a stretch reflex, which is a palpable catch that occurs at the end range of motion, so when the muscle is lengthened. Moderate is when the stretch reflex occurs at the mid-range, and severe is when the stretch reflex occurs at the beginning of the range of motion, when the muscle is shortened. To assess muscle tone, you need to record the test position that you have your client in, whether that be sitting, side lying, standing, or supine. And this is important because depending on how your client is positioned, that'll affect their tone. So you may have lower tone if you're laying down, or you may have higher tone depending on if you're against gravity. And you always want to have your client be in the same position so that the next time that you assess tone, you can have the most accurate result as possible. You also want to have your client rate their pain before you begin to assess their tone. If they say that they have a shoulder pain of 9 out of 10, it may not be appropriate to assess their muscle tone. To begin, though, you will hold on to the lateral aspects or the bony prominences surrounding the joint that you're testing. You'll want to note the weight of the muscle, how it feels in your hands. But you don't want to provide stimulation to the muscle. That's why you're touching the bony prominences and the lateral sides. So the first time that you move through the range, you're going to go through slowly. Once you've gone through slowly, you'll have your client rate their pain. If they say that they're experiencing a great deal of pain at that point, you're going to want to stop there and figure out what the source of that pain is, because it's not appropriate to continue with a muscle tone assessment. If they didn't have too much pain there, you're going to go through the range of motion rapidly next, and you're going to try to feel for that catch or the stretch reflex, and you're going to note where it is in the range of motion, whether it's at the beginning, middle, or end. And that's when you use those labels of mild, moderate, and severe. Some general things to consider once you've done your muscle tone assessment is that you're going to want to avoid manual muscle testing with moderate to severe tone, because you're not going to get an accurate reading and you're more at risk of stretching or tearing the person's muscle. But it is useful to do manual muscle testing when the person just has mild tone, because if they do have this sort of tone, the antagonist will almost always be weak, and that's what you'll want to manual muscle test. Other factors to consider that influence tone are pressure sores, ingrown toenails, tight clothing, tight elastic straps on urine bag, obstructed catheter, UTI, constipation, fear, anxiety, temperature extremes, heterotrophic ossifications, which are bony growths where they don't belong, and sensory overload. Another important thing to remember when you're assessing a client's muscle tone is that different joints can have different levels of tone. So for instance, the client's shoulder could have moderate tone, their elbow could have low tone, and the wrists and digits will have severe tone. And it's just important to keep this in mind when you're working through your therapy, as each muscle and joint does not have the same level of tone necessarily. Even if you just test one, you have to test the other surrounding if you think they may have tone. The first time that I do tone assessment within the clinic, if that's within the setting that I practice at, I'll probably want to do it with an experienced therapist who has done it before, just so that I can have accurate documentation of it and that I do it correctly, and that my hand placement isn't stimulating the muscle and I'm correctly on those bony prominences that are so important to be testing on. During my last fieldwork, my fieldwork educator did an assessment of muscle tone on one of the clients, but I was at Glenwood Resource Center, and she said one of the difficulties in assessing tone at this setting is that everyone there has an intellectual disability, so it's difficult to know if they're understanding exactly what you're saying you're going to be doing. And the patient that she was doing the muscle tone assessment on, she felt a catch during the rapid movement, but she was unsure if it was because that he felt uncomfortable that he was manually making catch or if he truly did have tone. So what I learned from that is that tone isn't always the easiest thing to assess and that other factors can influence the tone.